Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about hidden causes of hair loss. You see, over the last 30 years of practice, patients come in with many different chronic conditions. Most of them come in with fatigue, aches and pains, headaches, brain fog, digestive issues, skin problems, and hair loss is a very, very common symptom that most women come in with. And there are a number of different causes for this. We're going to go over some major causes for this, and then we're going to focus in on a couple of them and give you some simple solutions on clearing this up. So first of all, hair loss, it actually, in a sense, can be a good thing, and that it's telling you that something is going on. It's like, how can hair loss be a good thing? Well, it's giving you an idea that something's wrong inside your body. It's like driving in your car and a warning light, engine light goes on. Like we were driving to Orlando to a conference a couple of weeks ago, and the oil light came on in the car, and instead of getting all pissed off and, oh my God, at the light that's coming on, and it's very distracting, it was on the whole time blinking. It's like, no, you need to check and fill up the oil. You need to take care of that. So in the same sense, hair loss is a warning that something is going on that's not right inside your body that can lead to other things, which we'll get into now. Like, for instance, the most common causes I see are thyroid and other hormone issues. So if a lot of times people go to the doctor, they get their thyroid, they get a general lab test, and they'll check maybe your TSH, one thyroid value. Oh, your thyroid's fine. When in actuality, if you're having hair loss, you really need to get your thyroid checked out thoroughly, and that includes TSH, free T3, free T4, reverse T3, and your 2 thyroid antibodies. Those 6 values will then give you a complete picture of what's going on. I often have patients coming in saying that their doctor said their thyroid is fine. And when we do a thorough evaluation, in fact, it's not. And that is a very, very common cause of hair loss and can easily be rectified once you balance out, once you get the numbers and then work towards balancing that out with, oftentimes with specific either prescription medications or some natural things that you can do as well to balance out the thyroid depending on what's going on. Other common causes we'll run through, with other hormonal issues, estrogen, progesterone, testosterone, adrenal issues. If you're under stress for long periods of time, adrenal issues can cause hair loss. Nutritional deficiencies are a very common cause of hair loss. And these include certain B vitamins, zinc, vitamin D, and iron is a very, very common cause. Probably more, other than thyroid, iron deficiency is so common in causing hair loss. So it's just something that doctors just don't really ever check at all unless you ask them specifically and ask them specifically what to test. So ferritin is the test that you want to check in your blood. Like when our patients come in and we do a comprehensive female panel or male panel, I check ferritin levels and 2 or 3 other different iron factors in the blood. So the range of ferritin is around from 10 to 300. So if you say your doctor does check this and you're at 11, oh, everything's fine. Or if you're at 299, everything's fine. Well, no, it's not. I mean, does that make sense to have a almost 300-point range that could be normal? Actually, below 50, your hair can start falling out. And as it gets even lower than that, 40, 30, it can fall out even more rapidly. And I had a patient earlier, last year actually, she was 38 years old and came in with her main, let me just see, yeah, her main symptom, well, she had many different symptoms. She knew she had a thyroid condition, fatigue, anxiety, brain fog, just probably 30, 40, many different symptoms, but one of her main things that got her in here was hair loss, because she'd been to her doctor, many other doctors, traditional and functional medicine doctors, and she was just so upset at this hair loss. So when I checked her iron level, we did a comprehensive panel including ferritin, and her level was 7. Okay, so remember I said like 10 to 300. 7 her level was, and below 50, 40, hair starts falling out. So this was an amazing thing because there's just a very clear answer as to what's going on. And as we did the supplementation, as a matter of fact, the iron supplement that we use, it's a highly absorbable, non-irritating iron. So a lot of people don't like to take iron because it's constipating and irritating to the stomach, and they just don't do well with it at all. So the form I use, we'll actually put a link to it here, is highly absorbable, non-irritating, non-constipating. So after taking this, and it takes, at that level, it takes many, many months to build up your iron stores, but as her levels started to build back up, her hair loss stopped falling out and gradually started growing back and getting thicker. So it's a process and it takes time, but once you find out the answers and the causes, then it can be absolutely be turned around. I mean, there are other, as far as, I'll touch upon a few other causes as well. You know, as far as toxins, toxins are an issue that can cause hair loss. And one of those toxins, well, besides heavy metals, mercury, lead, and other environmental toxins, one of those toxins can be iron. I know, I just talked to you about how iron deficiency is one of the most common causes you see for hair loss. Well, too much iron can cause hair loss as well. So before you go and start taking iron, you definitely need to have your levels checked, because if your levels are too high, then that hair loss can ensue from there. So another example is just recently I had a patient come in her early 60s, and her levels of ferritin were over 1,000. So remember, 10 to 300, ideally you want like 60 to 90. Hair loss occurs when it drops, say, below 50. She was over 1,000, which is so toxic. That can cause organ damage, including having your hair fall out. So instead of just running out and buying an iron supplement, because I told you 3 minutes ago, you want to get your levels checked. And if your iron levels, like in her case, are too high, then there's certain protocol we use to eliminate the toxins, the heavy metals, in her case the iron, from her system, which takes quite some time, but it can be accomplished. And as that takes place, then hair can start growing back. So that's what I mean, where this hair loss can actually, in a sense, be a good thing if it motivates you to, say, get checked out and see exactly what's going on. I mean, there are other causes as well. There's infections, especially fungal yeast overgrowth if you have too much yeast in your body. Also autoimmune issues, different autoimmune conditions, say lupus, RA, thyroid autoimmune conditions, and then there's an autoimmune condition specifically for your hair. So all those can cause hair loss, and how we address those is, again, getting to the root cause. And it's a specific diet I use called I call it the free diet because it's free of those, the most common allergens and those foods most commonly responsible for inflammation and digestive issues and other chronic conditions. So if you want a link to a free copy of phase 1 of the free diet, we'll include that for you below as well. Other issues contributing to hair loss have to do with, going back to chemical toxicity, things you use externally too on your hair, which is a whole other topic. But it basically comes down to hormones, including your thyroid is a big one, adrenals, and nutritional deficiencies, toxins, food sensitivities, infections, especially yeast, fungal overgrowth, autoimmune conditions. So, and medication, going back to toxins, medication side effects are a big cause of hair loss. Some common ones, birth control pills. Yes, that can cause hair loss. Antidepressants, blood pressure medication, all those have side effects of hair loss. So it comes down to really diving in. You have this warning sign, something's going on, let me go in and get checked out specifically to see what's causing it. And once you do that, not only can you reverse hair loss and have it start growing back, but these other symptoms and damage that was being done to your body can also get cleared up. So if you liked this video, please share it with others. You can subscribe to our channel as well. And if you'd like I said, a free copy of the free diet below, you can click on that. So thanks very much for joining me today, and look forward to seeing you next time. Thanks again.